Now on News for Utah, can fasting help improve your health? Saray standing by with more on that.
Well, we are going to try to find out, and here to talk about it is intermittent fasting. With me is Dr. Benjamin Horne, Intermountain Medical Center Heart Institute. And what exactly constitutes as fasting?
Well, there are a number of different regimens. What we are studying is a 24-hour water-only fast, and we're looking at it 1 or 2 times a week.
And this is really fascinating. You guys are targeting to see if it helps a certain population with chronic problems such as diabetes. Name some of the others.
Right. People who are overweight, have high triglycerides or a high blood pressure and so forth, risk factors for metabolic disease, and then also a modestly high cholesterol level. And we're looking to see if the fasting over a period of 6 months, once or twice a week, will reduce cholesterol and these other risk factors, as well as to bring down markers of cognitive dysfunction.
And you said that there's been some studies in the past that showed some positive findings, but this is really going to look at a bigger number and random patients, correct?
Right. So people who participate, there's a 50-50 chance that they will be fasting or just eating their normal diet. And those previous studies have primarily looked at weight loss. Well, when you don't eat, you tend to lose weight. But we're really interested in the group where they've developed risk factors for these chronic diseases. And can we pull them back from the brink of being diagnosed with disease? Can we use fasting as an intervention prior to the need for medications and so forth?
So who exactly are you looking for? Because it's a very specific population, age group, and certain diseases that they may have.
We're looking for people who are ages 21 to 60 and have a cholesterol level that doesn't quite qualify them to have a statin medication to reduce the cholesterol.
Okay.
And then just one of those other metabolic factors, high blood pressure, overweight, diabetes or pre-diabetes, just an elevated glucose or blood sugar. And then we're looking for people who are willing to try. They may not actually be randomized to do it.
And the hope is that this will prevent some of these chronic issues. Let's also talk about some of the other things of fasting. How hard is it for these patients? You guys have started. You have about 30 patients now, looking for about 120 or so.
Right.
How hard is it to convince people, hey, let's try this 24-hour fasting?
Well, it depends on the individual, and typically what we find is people who are volunteering for this, they've been concerned about their health. They know that they're on a road towards chronic disease, but they don't quite know what to do about it. And there are people who are not willing, but people who are willing are pretty energized and they want to try it out.
Very cool. I'm sure it's a jolt to your system when you do that for 24 hours. Where can they find you? The number is right there for people who want to participate, right?
That's right. And they also, we have a website. If they go to intermountainheartinstitute.org, there's a link on that website and they can find us.
Okay, fascinating study. Thank you so much.